ano no, first, ano ba yun eh? First, scale that we can use no para mabalaan ta if ano ka intense ang exercise nga hatag ta kay patient is through your rating of perceived exertion or the Borg scale. Sorry siya. So this is very important, guys. Reiterate ko liwat. And the most important numbers to remember are your 11 to 13. You're fairly light to somewhat hard. Because dapat amo ni ang ginahambal si mo ni patient while you're performing exercises. So makuton mo siya. So sir, kamusta ang exercise? Is it very light, very fairly light, somewhat hard, hard, very, very hard? Tapos mamba si patient na fairly light. Okay, so meaning ara pa siya sa sulod sa recommended exercise intensity that you are giving your patient with cardiac problems, okay, or your CAD. So this was developed by Borg, the Borg RPE scale, and the common limitation no, of exertion is between fairly light and somewhat hard. So very ano siya, no, very easy ta siya to remember. Okay, so if wala nyo na-catch kagina, no, I was telling the screen here nga when we were in college, ang amon di nga mnemonic. Hindi siya mnemonic, actually daw joke siya, no. Nga magpalangga ka, dapat fairly light to somewhat hard lang. Bali, 11 to 13 lang dapat ang iyang intensity para hindi ka makapoy. Okay? So that time when we were students, so very funny siya, no? Tapos subong, it sounds so corny, but it's effective. Because sa subong, every time madumduman mo na siya, basta cardiac rehab, dapat fairly light to, ano lang siya, somewhat hard. Pero hindi ka pagkapoy yun. So 11 to 13 lang. Dapat lang i-effort mo. Okay? Or dapat nahatag mga love, char. Okay, next. Another way no of knowing or giving an intensity sa exercise ng patient is through heart rate. So, the common exercise prescription that is based on your heart rate, based on the maximum heart rate, no, or MHR ni siya, or the MHR of your patient, is 70% to 85% lang. So that is the common one, especially for those who have cardiac conditions. Next naman for patients who are deconditioned. So they've been bedridden for so long, they can train up to 50% to 60% lang of their maximum heart rate. Okay? So for exercise tolerance test, they should be administered always, no, for patients with documented CAD. So let's say, for example, si patient may diagnosed siya with coronary artery disease. So this patient needs to undergo an ETT. Okay, para makita ta kung pila gid man, no, or how anong extent sang iyang aerobic capacity ang affected due to the ischemia sang naging cause ng iyang coronary artery disease. So another way no of giving an intensity kay patient through sa exercise is through METs. So diri mo mahambal nga pwede at the end at the initiation of exercise of rehabilitation dapat 1 to 2 METs lang tanay, and then gradually progress ka until makalabot siya sa mga 8 METs, okay, and more. Okay, so sorry guys, medyo katulak ko news. Okay, next, no, we can perform the talk test. So talk test is also a subjective test wherein it is easy for self-monitoring. So pwede siya along with your RPE, your rating of perceived exertion. Actually, heart rate can also be performed no via self-monitoring because patient pwede mo tudloan how to perform a palpation sa iyang radial pulse. So this one, you will know, no, na normal ang talk test if the patient can talk without becoming breathless. So while exercising, tapos gato ka sa iya, tapos wala siya ginahingal-hingal, so okay lang na siya. So it provides a fair indication that the patient is appropriately exercising below his or her anaerobic threshold. So bali, even nag-exercise siya, kaya niya pa mag-talk because there is no shortness of breath or dyspnea. So let's go to the math part. So here, these are the formulas that you need. So this one, no, So, ari na ni siya nga daan. These are already predetermined. So, for those with a deconditioned or a heart condition, so dapat ang ilang percentage is only 40 to 60%. For the normal, like us, no, 60 to 80%. For the athletes, okay, 80 to 90% if they kung paano kita magkuha sa ilang target heart rate, okay? So before we get the target heart rate, no, via your Carbonence formula, we need to know what is the maximum heart rate of the patient or a person. So we perform this by subtracting our age from 220. So let's say for example ako, so what is my MHR? So MHR ko is 220 minus 26. Okay, so medyo mahina tayo guys sa math. So magka-calculator tayo. 220 minus 26 is 194. So dapat ang maximum heart rate ko lang is 194. So anything above 194 for me is dangerous na. Okay? So if we put this no sa Carbonence formula to get my target heart rate, THR ko during exercise, so 194 minus my resting heart rate. So let's say for example, no, example lang, ako resting heart rate, Abby, is 80. Okay, and then multiply that to normal, which is 60 minus 60 to 80%. Okay, so ang inyo target heart rate, guys, pwede siya nga ano no, pwede siya nga range siya. Okay, and then you plus it again with your resting heart rate, which is 80. Okay, so if we try to solve for that, so of course, first gid is ang parenthesis, so 80 times 60. So i-multiply ko siya guys ha. So you ano no, kay naka-percentage siya, i-decimal places mo siya. So 194 minus 80 times 0.6. So parenthesis 48 minus 2, hindi na siya minus guys, at 2 na siya. So 80 times 0.8, 64. Okay. And then you add you add 80 again. So if you try to solve this one, okay, so makuha mo siya ang iyang ang iyang siya, ang iyang ang akon nga target heart rate. So diri ma-distribute ka, so i-distribute mo no. So 194 minus 48. So butang mo da 194 minus 48. So that is 146. So naka-parenthesis ni siya ha. And then your next is 194 minus 64. So naka-parenthesis man gyapon is 130. And then add ka na naman 80. Okay, so i-add mo na siya. Okay. So 146 plus 80. So that is 226. Okay, 226 to 130 plus 80. Okay? So, amo na siya ang imong dosiling na no, sa imong Carbonence formula. Okay? Basta, ang importante di guys is when you try to when you try to get the target heart rate, dili ka mabase. Okay? So you should always base here. Right? So far, sa experience ko sa exams, wala magid siya gagwa. Okay, ang Carbonell's formula. Although it's very handy to know lang no how to compute it. Okay? Okay, so what are the contraindications for using your heart rate naman? So what are the instances wherein hindi mo paggamiton ang heart rate as an intensity scale when prescribing an exercise? So when the patients are taking beta blockers, so for patients who have CHF, no, as much as possible, we should use RPE or ang MET sa ila, but mostly RPE gid because your beta blockers can affect no ang heart rate. Patients with heart transplant, because of course there's also a heart rate affectation when the patient has undergone heart transplant. Pregnant women, and then those with hyperthyroidism, because people with hyperthyroidism, no, they have an elevated heart rate. So hindi siya reliable. Heart rate monitoring is not a reliable tool no for intensity for these patients. Let's talk about frequency. So how do you know no how frequent should the patient exercise? So according